Hello everyone, I'm Yoga Thiessen and I'm going to provide a very brief overview of my paper EEG-GRAPH. This is a joint work between the Mayo Clinic and the University of Illinois at Urbana-Champaign. A few years ago, former President Barack Obama initiated Brain Initiative, whose primary goal is to map the entire human brain. Many organizations, including NIH, DARPA, and the Kavli Foundation, are active members of this initiative. Through Mayo, we contribute to some of the studies under this initiative. In many of these studies, a common way of collecting data from the human brain is using electroencephalograms or EEG. Here I am showing an EEG recording collected using an electrode array directly implanted on the brain. In this particular case, we are interested in identifying spiking events like this, which we refer to as abnormal events. The exact pattern of these events may vary depending on the research problem, and identifying these events is paramount for arriving at meaningful conclusions. Manual identification of these events is cumbersome and it does not scale very well. Therefore, researchers are interested in developing tools that can detect these type of events automatically. Most of the existing works utilize the spectral characteristics of these events to detect them, but these methods suffer greatly from signal artifacts. In our paper, we present a graphical model-based approach that uses some additional attributes of these events to more accurately detect them. We observe that the adjacent electrodes in the brain show similar patterns in emitting abnormal events. In addition, some electrodes like this emit these events repeatedly. So we utilize the spectral characteristics of the events, its spatial patterns, and its repetitiveness to identify whether a particular window of EEG has an abnormal event of interest. As shown in this diagram, the presence of an event depends on the observation, its previous states, and the adjacent electrodes. Due to the flexible platform, we have adopted to use the factor graph paradigm to model this. We use random variables to represent the different entities and factor functions to represent the relationships between them. To show the feasibility of the model, we tested it for the application of seizure onset zone localization for patients with drug-resistant epilepsy. We defined the factor functions based on expert knowledge for this specific problem, and based on our definitions, we show that a graph cut approach can be utilized to efficiently perform graph inference. Our results indicate that our model performs significantly better than currently existing methods with very minimal computational effort. Now, to summarize, we developed a model based on probabilistic graphs to encode observational, spatial, and temporal relationships in brain activity and address a very important research gap in current brain research. Thank you.